Doctors and nurses, have any of your patients surprised you with their amount or lack of pain tolerance? A friend told me an old boy came in with a large laceration on his arm. Suturing it up took over an hour, but can be quite fun as you can chat to the patients. My friend was engrossed talking to him about his experiences in the Second World War, and really enjoyed treating him. The old chap was in good spirits throughout and told him lots of interesting stories about his time behind enemy lines or in trenches in Flanders. After he put the last stitch in, my friend started clearing up and found the local anesthetic bottle unopened. He realized he'd not put any local in at all, and yet the guy didn't once flinch, leave aside complain. When asked why he didn't say anything, he just said, "Oh, I thought that's how it's supposed to feel. I didn't mind. Lovely chatting to you," then walked out. Don't make me how they used to. Lignacane edits. Spoke to my friend last night. I totally didn't do this story justice. The laceration was sustained in a machete attack. Two guys tried to break into the man's house, and one slashed at him, but he fought them off long enough until a neighbor started to run over, and they scarpered. Such a relevant detail, how could I have forgotten? He had to clean the wound out thoroughly, which is even more painful than suturing. And to those of you pointing out the Flanders inaccuracy, that's purely my incorrect paraphrasing. It was WW2, so ignore the trench comment. I'll refrain from the obvious, I'm a Dr. Jim, not a historian line. Or perhaps I won't. Doctor here. My intern year in residency, I saw a 17-year-old kid who, when while playing hockey, tried to stop a puck with a gloved hand. It struck his fingertip, injuring the base of his nail, causing a significant deformity. His nail bed needed repair, which requires first removing the nail. That is done by bluntly dissecting, separating the nail from the tissue below it. If your stomach didn't turn reading that and imagining it, congratulations, you have no soul. Typically, we use a numbing agent to eliminate sensation to the entire finger, using something called a digital block. I put it in. After 10 minutes, he still felt me touching his fingertip. I tried putting some around the nail. He still felt everything. His mother said his father actually had a similar thing. Lidocaine didn't work on him. I offered him a different numbing medicine. We can inject Benadryl in that case, or even knocking him out. He looked at me in the eyes and said, "Doc, just take it off." Without anything, yeah, it's fine. They fix our cuts without numbing medicine. But it's going to hurt a lot. I have to scrape, I know, so I went at it. He grabbed a towel with his other hand and I went to work. 45 minutes later, the nail was off, he was repaired, and I replaced the nail in its rightful place. The kid didn't even make a noise. Fire medic here. Farmers seem to be tough. One time a guy pulled into the front ramp. Got out of his truck and walked up holding his severed forearm in his other arm. Get him in the truck, take off. Along the way he states he lived down the road and wanted to get to us quickly. When asked why he didn't call 911 he replied, "I just cut my arm, I aren't dying." Also had a battle of the bulge vet tell me he didn't need a blanket. It was -7 with wind kill. My grandma grew up on a farm in Alberta and was unbelievably tough. She once broke her finger by slamming it in a car door, and splintered it herself with popsicle sticks and duct tape. Later her appendix burst, but we didn't find out until they took her to the hospital because she passed out at dinner in the retirement home. Said she hadn't wanted to bother anyone by making a fuss. Finally, she was diagnosed with stomach cancer. It spread through her entire digestive system. After she went into hospice, my mom was cleaning out grandma's apartment and found every single prescription bottle of painkillers mom had picked up at the pharmacy for her, unopened in a drawer. Knowing mom would eventually find them, my grandma had written a note saying she preferred to keep her mind clear. She was seriously badass. Her doctor. 50-year-old guy with a massive heart attack just lying there chilling. Ask him his pain level. Deadpan just a little. 5-year-old boy with both forearm bones fractured and dislocated. Playing on iPad with another arm. 60-year-old lady slips, falls, destroys pelvic bone. Just once one Tylenol and scooches out of bed wanting to walk home. After much convincing, she begrudgingly accepted that might not be a great idea. There are some bad-ass people out there. Yes, I'm aware there are silent heart attacks. There are 2 bones in the forearm. He broke both bones in the same arm. Unfortunately, he does not have a third arm. I was attacked in the air when the EMTs brought in an elderly woman with what they said was a sprained ankle. She had slipped while mopping a floor at work, and her coworker had called it in. Turned out she had broken both of the bones in the lower part of her leg, but was sweetly chatting with us. I was impressed as soon as I saw the x-rays. EMTs had no idea and had splintered her ankle over where her bones were broken. Not a doctor, but my goddaughter was born very prematurely, requiring a major open heart surgery at 2 weeks old. We were told by her docs that since she'd gone through so much surgical trauma the first few weeks of her life, as a neonate, her pain receptors' nerve endings would not develop normally. They gave us the example that if she put her hand on a hot stove as a kid, she would have sustained a severe burn before feeling any pain whatsoever. She never cried as a kid when she got shots, fell down, banged into things, even when it was enough to draw blood. I suspect her medical history was the cause. Radiographer here. As a student I met a patient who was a typical little old lady. She came in with far too many shopping bags, and walked extremely slowly. She'd been sent by her GP because she'd fallen getting out of the bath a few weeks previous. So, we brought her in and took the first image, AP pelvis if you were wondering, and her pelvis was absolutely ruined. Turns out she had slipped and fallen with one leg in and one leg out of the bath, and taken the whole fall on her vagina. Not wanting to cause a fuss, this woman had ignored the pain and carried on her life as normal for weeks. Long enough for the fractures to be fairly healed, albeit in a strange way, not really resembling a pelvis much anymore. Not her, but actually a cashier at a fast food place. A woman ordered 2 meals, and since she was a little older, really old actually, I offered to bring her food to the table, so she wouldn't have to wait. I get there, and her husband had wads of paper towels stuck all over his arms with electrical tape, and his right hand and part of his face were a mix of blood and second-degree burns. Turned out he was working on his lawnmower, and the engine blew up on him. They stopped for lunch on the way to the hospital for burns, and the metal they couldn't get out. He was acting like it was nothing. Working as an EMT, I got called to a 64-year-old female, slipped in her house, possible sprained ankle. When we got there, the woman is sitting in a chair with her legs stretched out in front of her, but she had long pants and slippers on that covered the entire ankle, so I couldn't really see it. When we walked in, she was talking and didn't really seem to be in any pain at all, so I figured this was going to be an easy trip. I kneeled down in front of her to take a closer look, and wasn't I surprised to find that it wasn't just broken, it was fucked right up. I mean, the foot was at a 90-degree angle to the outside, and it was also leaned down, so what should have been the side of her foot was facing straight down, and the bone that should have been holding the ankle in place was pushing against the skin on the inside of her ankle, so hard that it was about to rip through. I was bewildered at the fact that at that moment she said, "It doesn't hurt, so I hope it isn't broken." She hardly made a peep on the ride to the hospital. 35 miles, very bumpy. Come to find out she had multiple sclerosis, and that makes people feel pain differently. Not an air nurse, but a medical technician at a couple of large events in my country. Working at a racing track, I had both of these people come in on the same day. Male, 54 years, Swedish, small cut on hand. His reaction to me pouring water saline in his wound. "Ow, it hurts when you put disinfectant in there. Be careful." Male, 32 years, Finnish, deep cut in right forearm. His humeral bone was visible. "No, it doesn't hurt. Now just tape it the fuck up so I can get back on my bike." Yes, I mean the humerus when I say humeral bone. And yes, I mean the upper arm. Not a native English speaker, and also, it's 1 a.m. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice I said I couldn't move my leg, no tears, screaming or anything. No one believed me, but after a minute or two I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally, and no one believed I was actually hurt, until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. Not a doctor or nurse, but this happened to me. I completely shattered my knee and part of my leg after I was running and slipped on some ice into a stone wall. I was with a group of friends and all they saw was me slide and hit the wall. They came over and asked if I was okay. In a normal voice I said I couldn't move my leg, no tears, screaming or anything. No one believed me, but after a minute or two I convinced them to call 911. The whole time I was waiting for ambulance, about 30 minutes, I was talking to them normally, and no one believed I was actually hurt, until I started going in and out of consciousness. Right as the paramedics got there, I started to wake up. I had a few patients in triage swear that their pain was 10/10 while eating, drinking, laughing, playing on cell phone. I'll chart whatever number that they set and then put in the notes, patient laughing, insert verb or emotion. I had one nurse that when a patient would say a certain number, she'd hand them a card that would say, at a pain level of 7 you would be sweating, vital signs would be elevated, you would be nauseated and probably vomiting. Then she'd ask, you sure you're 7? 9/10 would change their answers. My dad has an unusually high pain tolerance. He was cleaning a fishing pole in our backyard once when he didn't notice that the pole had splintered and pulled his hand down on it. The force causes the pole to snap in half and drive itself all the way through his hand. He stood up, walked in the kitchen with pole hanging out of his hand, and calmly asked my mom if he should just pull it out or go to the ER. Since it was a fiberglass one, he opted for the ER just in case something was broken off inside his hand. The list goes on and gets worse. The other was when he fell off a ladder and shattered his leg. The bone came through the skin, and he was bitchy about going to the ER. Not an ER doctor, but I went to the ER with my younger brother after a ski accident. My brother fell on his back off quite a big drop, causing his sternum split open. A few runs later he said he was sure something was wrong with his chest, so we eventually got to the ER. The doctor was shocked that he was able to continue skiing after it, and that he wasn't writhing in pain when it was touched. My brother's explanation was, yeah, it hurts, but I can't do anything about it. Med seekers and junkies coming down have the same level of pain tolerance. Barely touch the junkies and they flip out due to pain, whereas the med seekers attempt that shit and overact. I saw a guy try to fake a seizure, and it was the funniest shit ever. He was curling his hands up like he had CP, and leaning his head back to gather spit, so he could foam at the mouth. Med seekers will always be allergic to morphine and eat diluted and Ativan. I don't think I have met anyone with a high pain tolerance. Some chick came in with cysts on her ovaries, and declined meds because she was in recovery, so that is actually pretty badass. Nurse here. Well, in school, I had a 7-year-old girl who had broken her hip by getting bounced off a trampoline. They lived a few hours out of town, and when it happened, they knew she was hurt, but not how bad, so her parents put her in the back of the truck and hauled her, for 45+ minutes to their local hospital. She got there, they did x-rays and found it was way too bad for them to treat, and that she needed to come to us. They rushed the family out, without anything for pain for this little one, for another hour-plus ride to her. This girl didn't shed a tear, she was hands down the toughest patient I've ever had. Had a 19-year-old do the same while skateboarding, and I had to pull him out of the car while another nurse held his leg in place. Some people will amaze you with their strength and braveness. I broke my wrist when I was 12, after a bad bike crash. I flipped the handlebars and landed on my neck and slid a couple dozen feet. The impact shattered my helmet. Anyway, in the ER, nurses are setting up an IV in the arm that wasn't injured when I explained I landed on my neck, and it was hurting. They asked where, so I instinctively used my broken wristed hand to point. Every single person in the room goes poo, and just kind stops and looked at me, and I guess I was in shock because I kind of just looked around like WTF happened. Not a doctor, but my doctor seemed kind of surprised when I went back for a post-surgery appointment and told him that I had not taken any of the prescribed pain medication after getting my tonsils out. I had what I thought was a good reason at the time, though. At the pre-op appointment, he said that the pain is usually worst on the second day. Therefore, he suggested that I take a partial dose of the painkillers on the first day, then take the full dose on the second day, and use as prescribed until I recover. For some reason, I decided that it was a better idea to not take anything at all on the first day, and just wait to take the painkillers when the pain got unbearable. I kept waiting for it to get worse, and eventually it got better. Oops. Patients in a sickle cell crisis. I've pushed up to 14 milligrams of Decladio, 2 milligrams at a time, into these patients without a resulting change in vital signs or mentation. However, I've also seen young men competing in rodeos who have been stomped by a bull a few times come in with broken ribs and a pneumothorax saying, "It's just a scratch," and declining pain medications.